Right now to answer all of our questions about COVID and the vaccine is Dr. Robert Finberg, who's a professor of medicine at UMass Medical School. Doctor, it's great to see you. Thank you for your time as always. And let me start with what's happening at the VA here. At the same time that there are concerns about vaccine supplies running out in some states, we learned that 1,900 doses at the VA hospital in Boston had to be thrown out after that storage freezer got unplugged or disconnected. Is there any indication, it's a multifold question, but any indication of how many doses here or in other states have been thrown out? What's the overall impact? And forgive the simple nature of the question, but does every dose count?
So I'll answer the question in two ways. Yes, every dose counts at the moment because we're still short of vaccine. I think that is going to change. I think obviously the administration is putting a big push using the Defense Production Act and other things to increase the number of vaccine doses that are available. And there are more vaccines coming out. There are great things about the Johnson & Johnson vaccine, which we hope will be here soon. Unfortunate accidents happen. I think this is an unusual event, and that's not our biggest problem. But I hope that will not happen in the future.
Yeah, of course. So, Dr. Finberg, you are on the state's vaccine advisory board. We're getting a lot of viewer questions about the plan. One is, why are some remote hospital employees who don't have any patient contact with COVID patients or any other patients really now getting the vaccine when at first the phase 1 guidelines didn't include those people?
Yeah, the phase 1 guidelines don't include those people. And I would say, certainly speaking from my own institution, we're not giving it to those people. There may be some misunderstandings about this, and I don't think that that's a problem that's very, very common. Maybe that's happening in a few employees.
That's an interesting answer. And this is another viewer question, and honestly, this is just anecdotally, I get this when I go to the gas station, I go to the hardware store. Honestly, this is on people's minds.
Okay.
Why are inmates being vaccinated ahead of some other people, older people, who are at high risk?
Well, it's a good question, and there really is a good answer. Like in other crowded residential facilities, like nursing homes, the rate of infection is much higher in prisons than in the general population. In the U.S., maybe 5% of the population has been infected. In the prison population, it's well over 20%. And therefore, both the prisoners and the people that take care of the prisoners, the guards and other people, are at risk. And if we vaccinate those people and eliminate that, we are protecting the prisoners and the rest of the community.
So we now have 2 confirmed cases of that UK variant, at least that we know of, in the state. Yesterday, Dr. Fauci said it's more contagious, but it hasn't been found to be more deadly. Today, Boris Johnson in the UK saying there's evidence it is more deadly. So what can you tell us about that variant at this point?
Well, the data change every few minutes, as you know. However, and I can't tell you whether it's more deadly. Dr. Fauci's counterpart, the British science advisor, Dr. Vallance, says he's not quite certain about the data. What I would say is this, that viruses will tend to make variants. That's not surprising. The good news is, so far, the vaccines seem to be working against the variants, including the UK variant. I will optimistically point out that the major vaccines, including Pfizer, Moderna, and now the Johnson & Johnson, are all directed at the part of the virus that the virus needs to bind to the cells. And that's a good thing because it's unlikely the virus is going to find out another way.
Dr. Finberg, thank you so much for your time. It's great to see you.
Great to see you.
Be well. Have a great weekend.